Hello, ladies and gentlemen. This program we will discuss different subjects. Thalidomide. Thalidomide is a synthetic glutamic acid derivative that was initially synthesized in 1953. It was used widely in Europe between 1956 and 1962 as a sleeping aid and antiemetic for pregnant women. During this time, an estimated 10,000 children were born with severe malformation, including short, flipper-like limbs. Phocomelia, ultimately attributed to thalidomide use. The mechanism of action of thalidomide is not fully understood. It may involve immunomodulatory and anti-inflammatory and anti-angiogenic effect, but critical role immunomodulatory, anti-inflammatory effect. Immunologic effect can vary substantially under different conditions and may be related to suppression of excessive tumor necrosis factor production, as well down modulation of selected cell surface adhesion molecule involved in the leukocyte migration. Although the thalidomide administration has resulted in decreased circulating level of tumor necrosis alpha in patients with ENL, it can cause the increase in plasma. Tumor necrosis alpha level is HIV seropositive patients. Anti-inflammatory and immunomodulatory effect of thalidomide may be additionally mediated by the suppression of macrophage-related prostaglandin synthesis and modulation of interleukin-10 and interleukin-12 production by peripheral blood mononuclear cell. The anti-angiogenic effect of thalidomide have been demonstrated in vitro in human umbilical artery explant model. Several mechanisms have been implicated in the anti-neoplastic effect of thalidomide in treating multiple myeloma. First, thalidomide and or its metabolites appear to have direct anti-proliferative and pro-apoptotic effect. These properties are believed to be the part mediated by inhibition of the transcription activity. Inhibition of transcription activity of nuclear factor KB is multiple myeloma cell. This is very hot point, top point important. I would like to say again, these properties, anti-inflammatory character of thalidomide, these properties are believed to be part mediated inhibition of transcription activity of nuclear factor KB in multiple myeloma cells with resultant decrease in the production of anti-apoptotic molecules in tumor cells. Second, thalidomide interferes with the adhesion of multiple myeloma cells to bone marrow stromal cell, which instrumental in tumor cell survival and proliferation. Third, thalidomide inhibits the production and release of various growth factors. vascular endothelial growth factors, basic fibroblast growth factors, and interleukin 6 that regulate angiogenesis and tumor cell proliferation. Finally, thalidomide. Thalidomide possesses potent immunomodulatory effect, including enhanced natural killer cell mediated cytotoxicity in patients receiving thalidomide for multiple myeloma, and increase in the number of circulating natural killer cells, along with increased plasma level of interleukin 2 and interferon gamma has been observed. And some details continue. Lenalidomide. Lenalidomide is the thalidomide derivative that shares the immunomodulatory and antineoplastic properties of its parent compound. However, lenalidomide appears to be more potent in vitro with less non-hematologic toxicity. In clinical studies, it has well-established clinical activity in the treatment of both multiple myeloma and the myelodysplastic syndromes associated with the deletion of 5q cytogenetic abnormality with or without additional cytogenetic abnormalities. The mechanism of action of lenalidomide remains incompletely understood. As with thalidomide, lenalidomide possesses antineoplastic, immunomodulatory, and anti-angiogenic properties. It inhibits the secretion of pro-inflammatory cytokines and increases the secretion of anti-inflammatory cytokines from peripheral blood mononuclear cell. Multiple myeloma cells appear to be particularly sensitive to lenalidomide, with inhibition of malignant cell growth in the is human multiple myeloma cell lines, including cell cycle arrest and apoptosis. These are very important points. Lenalidomide is administered orally and is rapidly absorbed from the gastrointestinal tract. Maximum plasma concentration is reached in 0.625 to 1.5 hours after dosing. And continue. These drugs, thalidomide and lenalidomide, dosages, schedule, cycles, intervals had been expressed, others programmed, and from time to time we will talk about these dosage and program schedules and cycle intervals, knowledge, information. Some drugs that possess anti-angiogenic activity or inhibit angiogenesis, cetuximab, belinostat, histone deacetylase inhibitor, but cetuximab we want to use this drug. Especially we would like to use belinostat, histone deacetylase inhibitor, LBH 589, vorinostat, SAHA, gelecoxib, bortezomib, gelecoxib cyclooxygenase 2 inhibitors, bortezomib proteasome inhibitor, retinoids, carotenoids, and other micronutrients in cancer prevention. Retinoids, carotenoids, and other micronutrients. Cancer chemoprevention can be defined as pharmacologic intervention with specific nutrients or other chemicals to suppress or reverse carcinogenesis and prevent the development of invasive cancer. Two basic concepts support this cancer control strategy: multi-step and field carcinogenesis. Carcinogenesis is a chronic multi-step process characterized by the accumulation of specific genetic, epigenetic, and phenotypic alterations that can evolve over a 10 to 20 plus year period. From the first initiating event, the premise of human chemoprevention is that one can intervene and suppress at many steps in the carcinogenic process and over the period of many years. A wave of new technology, etc., high resolution endoscopy, laser capture, micro dissection, multiplex genes expression, protein array, and small interfering RNA is rapidly increasing our understanding of neoplastic evolution. It is now understood that the process can involve mutation, key tumor suppressor gene, and oncogenesis, epigenetic changes, aberration of histone acetylation or DNA methylation, genetic instability, and defect in signal transduction with clonal expansion and remarkably intraepithelial spread metastasis of premalignant cells. Field carcinogenesis was first described in the early 1950s. Field cancerization in the head of neck and subsequently was ascribed of many epithelial sites. The field concept a patient have a wide surface area. To date, retinoids, the natural derivative and synthetic analog of vitamin A, and beta-carotene, a member of carotenoids class, are among the best studied agents in human chemoprevention, for which their record includes several completed phase-3 efficacious trials, as we'll discuss in detail below. Whereas some trials have demonstrated chemopreventive efficacy for retinoids and carotenoids, adverse effects have also been noted, particularly in some patient populations. The antioxidant nutrient vitamin E and trace mineral selenium have also been evaluated in randomized cancer prevention trials, and based on some promising evidence of efficacy or selected tumor sites are undergoing further evaluation, as will be discussed in the chapter. Other micronutrients such as folate, calcium, and vitamin D are of more recent interest for the chemoprevention. Not only prevention, that's therapeutic. Dependence of dosage and therapeutic modality. With fewer completed trials to date, as we'll also discuss, because of space limitations, this various explanation. Research and explorative study. These drugs details we had been given before, and from time to time we will be gave some programs, dosage, schedule, roads. Conclusion. Retinoids, carotenoids, and other micronutrients in cancer prevention and therapeutic purpose. As reviewed herein, many first-generation trials of these agents in cancer prevention have been completed. Some of trials have been observed statistically significant reduction in the risk of primary endpoint. Retinoids and beta-carotene in oral pre-malignancy, retinoid in skin carcinogenesis models, calcium in colorectal adenomas, antioxidant nutrients in linxin, China for gastric cancer prevention, whereas others have observed statistically significant increases in the risk of primary endpoint, beta-carotene lung cancer prevention trials in smokers, and selenium prevention trials in patients at risk of non-melanoma skin cancer. But our therapeutic regimens, existence, micronutrients, retinoic acids, antioxidants, some cornerstone that not only preventive purpose, dosage and modality should be possible. The treated component, therapeutic components of cancer disease, total solution. Some of the first generation prevention trials produced some unexpected risk reduction. For example, selenium lowering prostate cancer incidence in skin cancer prevention trial, and vitamin E lowering prostate cancer incidence in lung cancer prevention trial. Researchers are now undertaking second generation cancer prevention trials that they hope will be better targeted and confirm the efficacy suggested in earlier studies. Considering only the completed trials, there is a limited overall evidence that retinoids, carotenoids, and supplemental micronutrients have preventive effect. Having said this, some subgroups within each of trial appear to have benefited from micronutrients supplementation, that is, lifestyle factors such as smoking and baseline nutrient status are increasingly thought to modify the effectiveness of particular intervention. That next decade research in cancer prevention will likely include a significant emphasis on determining who most need prevention. Classical explanation. Nuclear factor KB, non-steroidal anti-inflammatory drugs, lipoxygenase inhibitor, zileoton, zafirlukast, non-steroidal anti-inflammatory drugs, bortezomib, curcumin, T-polyphenols, 3 terpenes, D-thiolitones, DNA methylation, folic acid azacitidin, histone deacetylase, vorinostat saha, retinoic acid receptor beta, fenretinid, 9-cis retinoic acid, retinoid X receptor, targretin, vitamin D receptor, vitamin D free analog. Anti-inflammatory drug, non-steroidal anti-inflammatory agents represent a class of drugs that reduce cellular inflammation through modulation of eicosanoid metabolism. Eicosanoids are metabolites of dietary fatty acids, primarily linoleic acid. Linoleic acid is metabolized to arachidonic acid, which is stored in the lipid membrane and mobilized from the membrane by cytoplasmic phospholipase A2. Arachidonic acid is converted to prostaglandin by one of the prostaglandin H synthetase, commonly called cyclooxygenase 1 and 2. The reaction consists of first step conversion to arachidonic acid to the prostaglandin and of peroxide. Prostaglandins play important role in the controlling cellular proliferation, apoptosis, cellular invasiveness, angiogenesis, and in modulating immunosuppression. Because chronic inflammation, all problematic condition, dynamics, basic, fundamental factors should be possible. Chronic inflammation, dynamics, and carcinogenesis main essential. Vital role of carcinogenesis, cell neoplastic transformation. Vice versa, your cancer disease therapeutic application, therapy, treatment successful dependent this chronic inflammation dynamics, successful or unsuccessful, dependent this chronic inflammation dynamics. Prostaglandins play crucial roles in controlling cellular proliferation, apoptosis, programmed cell death, cellular invasiveness, angiogenesis, and in modulating immunosuppression. Since prostaglandin E2 is the most abundant prostaglandin in tumor-reducing local concentration of prostaglandin E2, may be a pivotal colorectal cancer preventive maneuver. Clinical trials, very broad and expand position. Key clinical trials of non-steroidal anti-inflammatory drugs for the prevention of colorectal cancer, prevention or therapeutic purposely. Treatment with aspirin at a dose of 80 milligrams. Some scientists using 75, 70 day. Some more dosage application to the cyclooxygenase 2 inhibitors. For instance, celecoxib, rofecoxib. Some scientists 100 milligram aspirin application study, and these I would like some drugs. Sulindac 100 milligram. Sulindac 150 and 50 milligram, Sulindac 400 milligram, celecoxib used 100 milligram or 400 milligram, 4 monthly, 9 monthly, 6 monthly. Sulindac 75 or 150 milligram, Sulindac 300 milligram, piroxicam, cyclooxygenase 2 inhibitor, piroxicam 7.5 milligram, 2 year. These dosage generally chemoprevention clinical trials and non-steroidal anti-inflammatory drugs and adenomatous colorectal polyps. But if you change them suitable dosage, possible the treatment, chronic inflammation treatments. Piroxicam 7.5 milligram 2 year. Aspirin 40, 81, 325, 650 milligram. aspirin 325 milligram, aspirin 81 milligram or 325 milligram, celecoxib, rofecoxib, aspirin 100 milligram, aspirin 325 milligram. Chemoprevention is the administration of natural or synthetic agent to reduce the risk of developing second primary tumors. Patients who have squamous cell carcinoma of the head and neck have been increased risk of developing a second primary tumor of the upper aerodigestive tract because of combination of exposure to carcinogens and or genetic predisposition. The risk of developing a second primary tumor is approximately 2.7% to 4% per year. Analog of vitamin A, particularly of retinoids, have been a particular focus of clinical investigation. Retinoids and beta-carotenes both may cause regression of the leukoplakia. The study used high-dose schedule of drug, 100 milligram meter square daily for 12 months. Retinoic acid, 13 Gs. Some same information, and I don't want to repeat all the time. Targeting nuclear factor kappa B, very important. Nuclear factor kappa B plays a major role in proliferation, survival, angiogenesis, and chemoresistance of pancreatic cancer and is constitutively active in pancreatic cancer cells. Agents that block nuclear factor Kb activation reduce chemoresistance to conventional cytotoxic agent. One agent of interest is curcumin. Diferulometan. Curcumin has shown to suppress nuclear factor Kb. Others program curcuma longa, detailed and some clinical and cancerogenic condition and some drugs samples had been given. Curcumin has shown to suppress nuclear factor Kb, and is one recent in vitro study. Curcumin inhibited the proliferation of various pancreatic cancer cell lines, potentiated apoptosis induced by some chemical drugs, and inhibited the constitutive nuclear factor Kb activation in the cells. Nuclear factor Kb transcription factor inhibition will because suppress nitric oxides and its radicals that suppress the energy generation system, mitochondrions and aerobic glycolysis, and then cancer cell go apoptosis, because apoptosis dependence adequate energy dynamics. Furthermore, tumor xenografts injected with pancreatic cancer cells and treated with curcumin and some chemical conventional drugs. Recent phase 2 clinical trials have evaluated the safety and efficacy of curcumin, and its impact on biologic correlates when orally taken daily by patients with advanced pancreatic cancer. In the 21 evaluable patients, low circulating curcumin was detected in serum, suggesting poor oral bioavailability. However, 2 patients showed prolonged stable disease at 8 and 12 months or more. Currently, studies with liposomal curcumin with increased bioavailability are being designed. Cyclooxygenase 2 inhibitors. Cyclooxygenase 2 catalyzes the synthesis of prostaglandins in the inflammatory response process. Cyclooxygenase 2 has been frequently shown to be upregulated in malignant and premalignant tissues. Cyclooxygenase 2 expression has been correlated with increase in invasiveness, resistance of apoptosis, and increased angiogenesis. The science behind cyclooxygenase 2 inhibition appeared so compelling that many clinicians had chosen drugs such as celecoxib or rofecoxib. In the absence of efficacy data and with the assumption that it could not hurt, although non-steroidal anti-inflammatory and selective COX-2 inhibitors clearly can reduce the development of premalignant polyps, evidence that use of the non-steroidal anti-inflammatory or selective COX cyclooxygenase 2 inhibitors, meloxicam, and for instance, as a beneficial role in the treatment of colorectal cancer, is lacking the large randomized BICC trial showed not benefit whatever for the use of celecoxib in terms of either safety or efficacy. In the absence of any emerging data to the contrary, routine use of cyclooxygenase 2 inhibitor with chemotherapy is not recommended only or alone. antioxidant reactive oxygen species have been implicated in the onset and progression of various malignancies, including prostate cancer. Oxidative damage may affect multiple cellular components, including lipids, proteins, and nucleic acids. Evidence from clinical trials suggests a promising role for selenium and vitamin E as a potential chemopreventive agents against prostate cancer, possibly through their antioxidant activity. Selenium is an essential component of several extracellular cellular glutathione peroxidase that protect cells from oxidative damage. By catalyzing the reduction of lipid hydroperoxidase, most of recent interest in selenium as a chemopreventive agent come from a large clinical trial evaluating the effectiveness of selenium in prevention of non-melanoma skin cancer. In this trial, 1,312 study participants with documented prior history and non-melanoma skin cancer were randomized, received 200 microgram day of elemental selenium or placebo. Subjects were followed for 4.5 years to assess the development of skin cancer and secondary endpoint the development other cancer, although the difference was found in the rates of skin cancer in the study. The incidence of prostate cancer was reduced by 2/3 among the randomized of selenium. Selenium 200 microgram daily and vitamin E 400 international units. And various detailed glucocorticoids, our main actors. Glucocorticoids are known to be active agent in the disease state and may provide palliative as well as PCA responses. Low dose prednisone 10 mg day. Dexamethasone has PCA declines of more than 50% reported in up to 59% of patients. Even low dose hydrocortisone may be associated with transient small decline in PCA. Dose response curves for steroids have been poorly explored and optimal agent and dosing regimens are not clear. Prednisone has been used at oral dosage of 10 to 20 mg day and dexamethasone is oral dose 0.5 to 2 mg day. And I would like again once more corticosteroids. Prednisone dose 40 milligram meter square per dose, schedule days 114, cycle length 21 days. Prednisone 40 milligram meter square per dose, 114 schedule days, 28 cycle length days. Prednisone 25 milligram meter square per dose, 114 schedule days, 28 cycle length. prednisone 40 milligram meter square per dose, 114 schedule days, 28 cycle length. Prednisone 40 milligram meter square per dose, 114 schedule days, 21 cycle length days. Prednisone 80 milligram meter square per dose, 117 schedule days and 14 cycle length days. Prednisone 40 milligram meter square per dose, 114 schedule days and 22 cycle length. And last one, prednisone 50 milligram square per dose, 17 schedule days, 28 cycle length days. Yes. Selenium. Selenium is a trace mineral found in soil, water and some foods. It is an essential element in several metabolic pathways, including the glutathione peroxidase pathway. This is glutathione peroxidase main dominant key point of antioxidant system. Others, superoxide dismutase catalase, for instance. Selenium appears to promote antioxidant activity in the body via glutathione peroxidase, a selenium-dependent enzyme. Initial evidence has suggested that selenium supplementation reduces the risk of developing prostate cancer in men with normal baseline PCA level and low selenium blood levels. This is the subject of large, well-designed studies, including the Nutritional Prevention of Cancer trial and the ongoing selenium and vitamin E cancer prevention trial, SELECT, as well as prior population and case control studies. The MPC trial on 1,312 Americans reported that 200 milligram of daily selenium reduces the overall incidence of prostate cancer, although these protective effects only occurred in men with baseline PCA levels less than or equal to 4 nanogram milliliter, and those with low baseline blood selenium levels less than 123.2 nanogram milliliter. The MPC trial was primarily designed to measure the development of non-melanoma skin cancer and not other type of cancers, and therefore these prostate cancer results can't be considered definitive to settle this question. Further study in underway. SELECT is still in progress with a goal to include 32,400 men with serum PCA level less than or equal to 4 nanogram milliliter. SELECT was started in 2001 with a result expected in 2013. Laboratory studies have reported several potential mechanisms of selenium's Beneficial effects in prostate cancer including decrease in androgen receptors and PCA production, antioxidant effect, angiogenesis inhibition, or apoptosis. It is not known whether selenium is helpful in men who already have been diagnosed with prostate cancer to prevent progression or recurrence of disease. It does appear that selenium may not be beneficial in those with elevated PCA levels or with normal to high selenium levels. It remains unclear whether men at risk or all men should have their serum selenium values measured. Results of the SELECT study may provide additional guidance. There is evidence that low selenium levels are associated with an increased risk of prostate cancer, and several mechanisms for the beneficial effects of selenium supplementation have been suggested. In the MPC trial, no benefits were seen in reducing the risk of colorectal or lung cancer, although an overall reduction in cancer risk was observed. It is not clear which specific types of cancer besides prostate cancer may be affected. This is dependent on other conventional and natural herbal medicine actors, combinations, and modalities. Green tea. Green tea is produced from the dried leaves of Camellia sinensis, a perennial evergreen shrub from which black tea and oolong tea are also derived. Animal and laboratory research reports that tea components such as polyphenols possess antioxidant, anti-angiogenic, and pro-apoptotic. These are directly or indirectly related to each other. But scientists look as seldom separately. As well as reduced serum estrogen levels, several large case control and cohort studies have been published, largely focused on gastrointestinal and breast cancer. Results are variable, with some suggesting chronic tea consumption may decrease cancer risk, but others reporting no benefits. Studies have been observational, and other lifestyle choices of tea drinkers may confound these results. 1 cup of green tea contains approximately 50 milligram caffeine, and excessive tea consumption may lead to adverse effect or toxicity. Green tea supplements capsules usually contain less caffeine, approximately 5 milligram of caffeine in 500 milligram. Vitamin A. Vitamin A is comprised of retinol and its carotenoid precursors, all trans-retinoic acid. Retinol analog is well established as differentiation agent. In patients with acute promyelocytic leukemia, however, there is little evidence for the use of non-prescription vitamin A supplements for cancer treatment or prevention. Proposed use based on antioxidant activity trials have yielded variable results, suggesting no reduction in prostate cancer risk and possible increased risk of lung cancer in high-risk patients due to possibility of hypervitaminosis with supplementation of this fat-soluble vitamin. Chronic intake of large doses is discouraged. Beta-carotene supplementation in men with low dietary beta-carotene intakes have been associated with reducing risk of prostate cancer. Some vitamins for instance all trans-retinoic acids and derivatives supported signaling pathway that the maturation of normal DNA dynamics. Vitamin C limited clinical research has been conducted on vitamin C ascorbic acid for cancer prevention. In the 1980s, there was initial excitement over epidemiologic evidence correlating high dietary vitamin C intake with reduced rates of cancer, although use of vitamin C in observed populations may have correlated with other healthy lifestyle choices, diet, exercise, that confound finding. A subsequent prospective trial found no reduction in rates of breast cancer. Preclinical evidence of reduced platelet aggregation suggests that risk may outweigh potential benefits. Patients may experience scurvy symptoms after abrupt withdrawal of chronic megadoses. Vitamin E, another antioxidant, fatty character. Vitamin E alpha tocopherol is fat-soluble vitamin with antioxidant properties. Epidemiologic studies suggest a possible reduced breast, lung, and prostate cancer risk with intake. However, prevention trials report no reduction in risk of lung, breast, or colon cancer. Initial research suggests slowed progression of prostate cancer in one trial using 3 times the recommended daily allowance. Therefore, further study is warranted in patients with existing prostate cancer, but efficacy for prevention is not established. Preclinical evidence of reduced platelet aggregation has been shown. Cranberry very important. Ginseng very important. Grape seed extract very important. Omega 3 essential fatty acids, fish oil, and some chemicals, compounds very important. That's all this program. Thank you very much. Thank you so much, and I hope we will join us together next program. Thank you very much. Thanks a lot. You are patient. See you soon. Others program.